and I was on mute, so I apologize for that. Let's start over. Thank you so much for joining us for today's webinar, From Ashes to Floods, Our Changing Environment. I'm Greg Berry, Assistant Director in the Office of Alumni Affairs. Just a quick note, since we're virtual, don't be surprised if something may seem out of place or technical issues like unmuting pop up. Sorry about that. If you have any audio or video issues, click the reconnect button at the top of your screen. That will get you back to the webinar quickly. Today, we're going to take a look at how the UAB School of Public Health is taking aim at current environmental health problems. At this time, I would like Kimberly Kopic, Director of Development for the UAB Office of Plan Giving, to introduce today's guest. Welcome, Kimberly.
Thanks, Greg. And good afternoon, everyone. It is my great pleasure this afternoon to introduce our featured speaker, Dr. Jeffrey Wickliffe. Dr. Wickliffe received his Bachelor of Science and his Master's of Science in Wildlife and Fishery Sciences from the University of Texas A&M. He received his PhD in Biology from Texas Tech. He served as the NIEHS Toxicology Training Fellow in the Department of Preventative Medicine and Community Health at the University of Texas Medical Branch. He then took his talents to Tulane University, where he served as assistant professor and then associate professor. It was to our great fortune that we were able to entice him to the UAB School of Public Health, where he serves as chair and professor of environmental health sciences. Dr. Wickliffe has dedicated his work to assessing, understanding, and ultimately preventing adverse health effects associated with exposure to environmental hazards. He strives to understand the role environmental factors play in the development of chronic diseases and to develop interventions to prevent or mitigate risk and promote healthy longevity. And don't we all want to live healthier for longer? Dr. Wickliffe, thank you so much for being here with us this afternoon.
Thank you, Kimberly and Greg. I really appreciate being here. Being new to UAB in Alabama, this is a great opportunity for me to virtually meet with some of the folks who are alums and for them to meet me and learn more about our department. We are in a major rebuilding phase right now in the School of Public Health with respect to the Department of Environmental Health Sciences. So I really wanted to spend some time today going over kind of what we are, what we're about, our academic programs and some of the research we're doing. And then what I'd like to do is wrap up before we start taking questions and having more of a dialogue with some of the initiatives that we're pursuing right now, especially with respect to climate change and health. So the outline today is just going to cover kind of what is environmental health. Oftentimes, when I ask people their first impressions of what environmental health is, they often think about an environmental health and safety office, which we have here at UAB to protect the workforce here and the students here that work and learn at UAB. But also they tend to think of, say, Jefferson County, Department of Public Health and some of the things that they do there, the air pollution programs, the water quality programs, food safety, restaurant inspections, pest control, all fair game too. All of that does fall within our very large umbrella because when we think about the environment here in our department, we're thinking about the environment on a very large scale. And when I say large scale, what I mean is very broadly, we define environment from the natural environment, the work environment, the community environment, the built environment, and all of the different risk factors that you can find in those spaces, whether they're in air, water, soil, food, or some other media, and how those can get into us and cause harm. Our mission is really no different than other departments' missions on this campus. We have a high priority focus on education and training. We also have a high priority focus on research and practice. The field of public health has two really large approaches to what it's trying to do overall in an academic institution like this. And that's to train the next practical public health workforce to go out and practice public health, but discover new knowledge related to environmental health and public health, and train the next group of researchers that will carry out future research. I'll go over some of the programs we have and the degrees. I'll try to do that quickly. I know that's a little dry, but one of my goals today was to either introduce you to our department or perhaps reintroduce you to our department, because we are in a growth and a rebuilding phase. So real quickly, our focus is on how the environment influences human health. We are also worried about non-human health, but our focus here as part of the School of Public Health is on human health, all the way from the individual out to international settings. We have a fairly small faculty at the moment. Again, we're in a growing phase, so we've got some active searches going. But we do cover a lot of ground with the small number of folks we already have. So we do research in and around the greater Birmingham area, but we also do research in other parts of the world. Again, the focus is on the natural environment, what's in our air, what's in our water, what gets into our food, which is increasingly a larger problem with such a global supply chain in terms of food, from chemicals to elements to biologicals. We also have a strong group that is focused primarily on the work environment. You might have heard the term industrial hygiene or occupational safety and health. That too is another environment that falls within the domain of environmental health and public health. And then we are increasingly interested and concerned with aspects of the built environment, and much of that as it relates back to climate change. So we have active research programs in and around the greater Birmingham area looking at areas where there's urban heat problems. More often than not, these are in some of our lower income, lower socioeconomic status neighborhoods where there's very little green space, very little tree cover, and a lot of cement and concrete. So these are problems we're trying to address right here in our local area that have implications for urban areas across the U.S. and really across the globe. Our mission, again, is fairly simple. We have three basic pillars of research, education, and practice. Research, we are securing funding from federal agencies like the National Institutes of Health. Specifically, we tend to focus on the National Institute of Environmental Health Sciences with NIH funding, with respect to NIH funding, but we also have individuals who are pursuing funding from the US EPA, from various foundations like Robert Wood Johnson, as well as the National Science Foundation. So we are expanding the targets for our research portfolio to better support our research and to broaden the scope of what we're working on in terms of technologies that we can deploy in environmental health settings to measure things that are in the environment, to exposures, to corresponding health effects. That all translates through our education pillar, where we integrate a lot of what we're learning with respect to our research into our coursework. And then hopefully this translates into the practice of environmental health in a public health setting. So those are our three major pillars. Again, we have a fairly small department right now. We have 10 full-time faculty members with a few specialized part-time faculty members, 8 full-time or part-time staff members. And then we have a number of other faculty from other departments who interact with our department on a regular basis or have secondary appointments in our department, especially faculty from the School of Medicine who are collaborating with us on our environmental health projects and provide the critical human health and medical knowledge to our studies. We also have a large collaborative effort both at the education and research forefronts with the School of Engineering. We have a joint academic program with them that's a master's. We have a master's program, a Master's of Science in Public Health, as well as a PhD. That's a joint program with folks in the School of Engineering. Our two major academic programs are environmental health sciences, environmental and occupational health. where we focus primarily on areas outside of the workplace, but because the workplace can be so broad, we do have folks that are working, especially in outdoor workspaces. I'll touch more on that as I go through the individual faculty and some of the research they're doing. But our focus really is to determine the exposures that humans and populations out in the world are experiencing, whether it be heavy metals in drinking water or biologicals in food, or inhalation of small particles, and then relating those exposures back to particular human health outcomes. We're very collaborative. We focus primarily on the environmental aspects of public health. So when we need to work with individuals, say, to assess neurodevelopmental outcomes in children, that's where we bring in folks from the School of Medicine, Psychiatry, and Psychology to help us actually do that more health-related work. So we're, by nature, a very collaborative group, very team-oriented in what we do. So our students are usually trained in interdisciplinary research as well. And this is really where science in general is headed anyway. There's much less of an emphasis on solely individual-based research projects, especially in public health and in biomedical research, which is kind of where we find ourselves most of the time. We also have a strong program in occupational safety and health, or industrial hygiene, where we're looking at a lot of the same issues, but as you find them in various workplaces. And again, from sort of the traditional factory type workplace to firefighters out on the front line that are working, say in Alabama, doing prescribed burns to prevent forest fires. We have practice-based degrees and we have research-based degrees. And our primary practice-based degree is the MPH, which, along with the other MPH degrees offered in the School of Public Health, has some overlap, especially with our core curriculum that all of the MPH students in the school take. But ours also has additional coursework where students concentrate on environmental and occupational health issues. Both in-person and online degrees, we've seen a recent uptick in enrollment across the School of Public Health and in our department as well, that we attribute to the recent and ongoing COVID pandemic. We are always looking for creative ways and ways to connect with our alumni that allow us to then connect with prospective students to tell them about what we offer here and why we think we are a good option for them in terms of careers. Careers in environmental health are numerous. It's actually, in terms of the total workforce and the total number employed in public health overall, it's in the top 3 of the different areas of the public health workforce. So much of the practicing public health workforce that's out there today is working in some aspect of environmental and/or occupational health. So there's a lot of good jobs out there, and we're always looking for students to take advantage of what we offer so they can find careers that that'll be rewarding to them as they practice public health. We also have research-based degrees. We have 2 at the Master of Science level, one with a focus in environmental and occupational health science and one with a focus in industrial hygiene. These are really designed to introduce students to research and train them in the practice of research. The intent of that is to have most of those students go on and pursue a PhD or a DRPH or something like that, a doctorate level type degree after concluding their MSPH. Or they can work for a public health agency in more of a research capacity, whether that be the CDC or a local county of environmental health, or the Alabama Department of Public Health or something like that. And then we have the final terminal research degree of the PhD or Doctor of Philosophy in Environmental Health Sciences, which is really designed to train students to do basically what I do for a living. And most likely these students will go on and pursue careers in academic institutions, or perhaps other research-based agencies and institutes like NIEHS, for example, at the NIH. We have courses in air and water pollution, courses in more of the social determinants of health and environmental justice, fundamentals of occupational safety and health, risk assessment and how to assess and manage risks, and then coursework in environmental toxicology and diseases related to environmental exposures. So it really runs the gamut of what you find out there in the environment, how it gets into the body. Once it gets into our bodies, what kind of toxicological mechanisms are activated that then can lead to human disease. And then once we have a better understanding of that, how do we integrate all of that information into a risk assessment type activity, so we can prevent and or at least mitigate risks going forward based on evidence. Our students go off and do a number of internships. This is not in any way a comprehensive list. And we place students in internships across the U.S. So recently we've had some students that have done various internships here in the local area, working with some of the river keepers, like Cahaba River Keeper. We've had several that worked at some of the as safety interns in some of the local or some of the regional companies like Georgia Pacific. We've even had students do internships here on the UAB campus with environmental health and safety. Those students often go on to other academic institutions where they lead those offices of environmental health and safety. And then we've had several that worked as environmental health assistants, safety training programs. Many of them are collecting and analyzing data. And often those lead to first careers, first steps out of an MPH or an MSPH program. This is a smattering of where our students have ended up in terms of their careers. We're trying to do as good a job as we can, trying to do better all the time in tracking our students that graduate from our programs and where they end up, and how we can stay connected with them. And again, I'm always looking for help from alumni and how to maintain our connections with our students and students as they become alumni. But you can see there's a variety of large companies, small companies, federal agencies, local agencies, and other local and federal agencies, and even some academic institutions that they end up with, including my former university, Tulane. We actually had one of the folks that did an internship with the Environmental Health and Safety Office here actually come to run the Environmental Health Safety Office at Tulane University while I was there. So here's our faculty. We're a small group. One other thing I would emphasize is we're a fairly young group, meaning that most of the faculty are at the assistant professor level. We have two sort of faculty lines or approaches. So we have faculty who are more research intensive, who are pursuing extramural funding to try to fund their research, or trying to secure internal funding from UAB to do their research. And then we have faculty that focus primarily on teaching. All of our faculty teach. So there aren't any faculty that simply just do research. So all of our faculty do teach. Some of the more research intensive faculty teach fewer classes than our teaching intensive faculty. And while we don't exclude or preclude our teaching faculty from doing research, those faculty tend to focus more on teaching. We do participate in undergraduate teaching in the BSPH as well. And so we've taken a very active role in that program. It's very popular. And so we want to continue to support that at any level we can. Here's a few more of us here. And again, I think you'll appreciate we're a small faculty, but as I mentioned, we're growing. And one of the areas that we are pursuing is climate change and health, which I really want to talk about at the end, kind of emphasize what our plan is there. So our research areas really cover everything that I've talked about before: air, water, food pollution, focusing primarily on assessing exposures. We also have growing strengths in climate change and disaster preparedness. A couple of our faculty are conducting research in this area, whether it be on urban heat islands here in the local Birmingham area, flooding issues related to recent severe storm events that we've had in the Birmingham area. As you all know, back in October, we had a major storm event where we got around 12 inches of rain in a very short period of time that flooded several areas. And several of those that are well known to flood in those type of events. And they're working on using GIS methods to map those sites, so we can start to think about how to design new developments in a way to where we can avoid areas that are problematic when it comes to heavy rainfall. We also have folks working in the work environment, all the way from, as I mentioned, outdoor workers, food truck workers, to those working in more traditional factory type settings. And then, as I also mentioned, we have a couple of faculty that are focused on sustainability. Dr. Price runs the School of Public Health's Office of Sustainability. She used to be doing this more at the university level, but has just taken on a more focused role in our department, where we're trying to make inroads in the sustainability such that we can be a model to the rest of the campus. We also have faculty working on environmental justice and social environmental issues, and how they can interplay with more traditional exposures and compound for possible health outcomes in human populations around us. So here are some examples. There's a couple of us that are focused primarily on environmental pollution and children's health, with a principal focus on neurological health, whether that be behavioral problems, attention problems, anxiety, but we also focus on respiratory issues like asthma. We're looking at both water and food contaminations and the impacts on maternal health. Another one of our faculty is looking at the use of electronic cigarettes and secondhand vape exposure and impacts on respiratory health. A number of us are looking at heavy metals in drinking water or food, and how that impacts children's cognitive impairment as well as adults. We have a growing concern that lifelong exposure to some of these heavy metals can affect adult neurological health in a negative way. So it's another active area that we're moving into in conjunction with individuals in the School of Medicine and the Department of Neurology, for example. So again, very collaborative, very cross-cutting work. We have folks that are looking at exposures here in North Birmingham. I'm sure many of you are aware of some of the long-running environmental concerns and problems that North Birmingham has had for decades. I mentioned wildland firefighters, primarily with a focus on individuals working in the forestry industry here in Alabama, which is a group that's not usually a part of this kind of research. We usually think of folks that are working out in the Western US, California, Colorado, and some of those other states that are really prone to massive wildfire. The last couple of things I wanted to mention, and then I'll get into the individuals, is a couple of things that the folks are working on in our occupational safety and health program, where they're really focused on developing newer innovative technologies for assessing exposures. That's not just in the workplace either. That's also developing technologies we can use outside of the traditional workplace. So I'm particularly interested in indoor air quality in residential homes, in schools, especially elementary schools, and how daily exposure to various chemicals in the air or biologicals in the air, including things like a COVID virus, impact learning behavior. Well, I work with individuals in my department that are developing new technologies to measure those exposures. They're also using some new 3D technologies to improve mask fitting, for example, including masks that people might wear. Hopefully we'll not ever have another pandemic, but if we do and we have to wear masks, maybe we can get better masks that work even better than the current mask. So lots of different things going on, spans a lot of different health issues. We have some current projects that we're a part of that are really large. These are the REGARD study, which is largely in follow-up phase. And this particular very large longitudinal cohort study was focused on geographic and racial differences in stroke. Stroke, for example, in Alabama and certainly in rural parts of Alabama, the Black Belt, for example, are unusually high. And one of the goals of this study was to try to figure out what are all of the risk factors that contribute to that. There's another study that's rolling out right now. These are funded by the NIH, by the way, is the rural study. They're really focused on health overall. And again, this is going to be another longitudinal, very large cohort study where UAB is a major partner. We in environmental health are playing a small role in those studies, looking at environmental risk factors that can contribute to overall health problems. I wanted to go through our faculty real quick, some of the research they're doing. Mariam Karimi is an assistant professor here in our department. She is focused on using spatial methods, spatial mapping methods. As you can see, there's a lot of maps on this slide, primarily looking at areas where there are urban heat problems and heat exposures are excessive, and then using modeling methods to estimate or determine what kind of canopy cover or green space additions one could add to those areas to try to mitigate those heat exposures. And this is very much a climate change and health focused research project and program. As you all probably know, temperatures are expected to continue to increase. More importantly, we are expected to have more warm days and more warm nights going forward, where perhaps the absolute high temperature doesn't change as much, but we don't have as much of a cool down on a regular basis. So we stay hotter longer. She's also been working with folks over in the School of Engineering, looking at modeling flash floods and flood impact in Birmingham. So the maps on the right-hand side there are really showing some of those areas that are very much prone to flooding in extreme weather events, especially extreme rainfall events. And the idea, again, is to use that spatial representation to mitigate problems. In other words, try to find solutions to existing problems, or as developers move ahead with plans or develop plans in terms of areas where they may develop in the future, these kinds of spatial representations can serve as a means for perhaps avoiding certain areas that are prone to such problems. Dr. Lungu is a full professor at our department. Again, our faculty are mostly younger in terms of career. They're junior faculty at the assistant level. There's a few faculty that are above that. And so again, I just kind of want to emphasize that, just so you folks know that we're in a rebuilding phase and in a growth phase. And you know, I'll end with asking for ways that I can move forward to find means to support our folks. And I'll get to that at the very end. Dr. Lungu's areas are in occupational safety and health. He runs the Deep South Center here in our department, which is funded by the National Institute of Occupational Safety and Health. There's a limited number of centers across the U.S. that have this focus on both research and education when it comes to occupational safety and health. He in particular is working on some really unique ways to measure environmental contaminants, especially airborne contaminants, using the single-walled carbon nanotubes. They're also called Bucky papers or Bucky sheets, but these are carbon-based materials that can be used to collect various chemicals in air and perhaps water, and then use innovative techniques to figure out what has been collected on those materials using other technologies. And again, this is very broad-based research that can contribute to a lot of research activities and educational activities in our department, not just within the occupational safety and health. He's also developed some 3D methods for developing new respirators and masks that would integrate 3D printing to then print customized masks for an individual based on a customized fit. It's been one of the biggest problems, not only in occupational safety and health, but in any domain where you find a mask to be useful for whatever purpose. And then using activated carbon fibers, another source of carbonaceous material, to collect and prevent exposures. So again, a variety of methods to that really cross several domains in environmental health. Dr. McCormick, who just attained professor status this past year, so congratulations to her. She's been with UAB for many years and has been a major pillar in the development of exceptional practice-based programs. She runs our internship program at the school level. So all students coming through the School of Public Health will now go through her office when it comes to finding internship opportunities. But she's also the PI and an active member of several research programs. The CDC has recently given Alabama large pools of money to track infection prevention and control. Lisa's the PI on that project. We've also received extensive funding to develop and carry out COVID testing in Alabama K through 12 schools. A number of the schools around Birmingham and Montgomery are participating in this program, and Lisa is a co-PI on that. So that's a good example of how our faculty and our expertise can be brought to bear on problems that we may not be anticipating, such as a pandemic, but we're really shovel ready in a number of ways, both from the environmental health perspective, but from the public health perspective, to be the leaders in these programs. She also is part of two very large research centers, one of them focused on impacts of arsenicals, primarily skin and lung issues, but also skin cancer as well. And then another program funded out of the School of Medicine that Dr. Vina Anthony is the lead on is the UAB Superfund Research Center, which is looking at the impact of airborne heavy metals on lung disease and the environment, which also integrates climate change components into it as well. So as climate change occurs, how might this impact either positively or negatively the exposures that individuals in certain communities, for example, North Birmingham, may experience. Jordan Nelson's one of the junior faculty in our department. She's kind of a dual, has really a dual role in that she's, compared to some of the more research intensive faculty, she teaches more. She's a graduate of our program as well, but she is also pursuing some training research funding from the National Institutes of Health to look at cardiopulmonary disease in wildland firefighters who are exposed to wildfire smoke. Biomass smoke is what they call this. And then she's principally focusing on wildland firefighters here in the state of Alabama and Georgia. Emmanuel Adame, he's another assistant professor. So again, I hope you're getting the idea that we're a fairly young faculty overall. He is principally a teaching faculty who teaches in both the undergraduate and graduate level programs here at UAB, and we do take a very active role in the undergraduate program and have several courses that have an environmental health component to them, all with the idea of preparing these students to go on and practice in public health, certainly at the master's level, the MPH. For undergraduates, we're also trying to give them more of a population level view of public health, because many of our undergraduates are not necessarily going to go on into a an obvious public health career. They may go to medical school or pursue graduate study in another area. So trying to give them a really broad-based overview of population health through their bachelor's program with an emphasis on environmental health. He's also working more and more to get students off campus, or at least out of the classroom and on campus, so they can kind of experience environmental health and public health with their own hands. So we really support all those kinds of activities. It's really great to get the students out of the class. They really enjoy that. And again, to the extent any of our alums can provide those kind of opportunities in any way, shape, or form, I would love to hear how we could do that. Xinghua Hu, another assistant professor in the department, is focused again on environmental and occupational safety and health. Occupational safety and health primarily. She's also the program director for the MSPH in industrial hygiene. She's got some really interesting research looking at air quality and heat exposures to food truck workers. As you can imagine, those little food trucks that people drive around when they're cooking away during the middle of the day or on a weekend or something, you might have even felt the heat coming out from one of those rather poorly ventilated commercial kitchens. So she's really concerned about heat exposures. And again, as we have longer, hotter days, how will that changing climate impact those commercial kitchen environments? She's also looking at the impacts of hand-arm vibration exposure among a variety of those in different work settings. If you can think about landscape workers, for example, who are working with all of the trimming tools and things like that, folks in the forestry industry that work with a lot of heavy equipment like chainsaws and things like that, they tend to develop some neuropathies in their extremities and in their upper arms. And she's really focused on how can we develop either approaches that these folks would take, or develop technologies that reduce these kinds of exposures. So you might not ever think about vibration as an exposure, but again, we cast every bit as a wide net when it comes to exposures as we do when it comes to how we categorize or classify environment. Julie Price, another assistant professor in the department, is primarily a teaching faculty. She also leads the School of Public Health Sustainability programs and is involved in a variety of other activities and organizations outside of UAB, as a number of our faculty are. Bruno Vilkasim, another assistant professor, is really looking at air pollution using low-cost methods and low-cost sensors to measure exposure to air pollution or measure particulate matter in environmental and outdoor air. He's also looking at the impacts of electronic cigarette use and vaping. Vaping is a real problem in Alabama and elsewhere, not just a problem here in our state, but it's a problem elsewhere, especially among younger people. And the tendency is to think, well, it's not tobacco smoke, so it's safe. And while I think evidence supports that it is a safer alternative to smoking cigarettes and tobacco, we really don't know how safe vaping is at this point, especially when you start adding a lot of the different agents and flavorings on top of that. So he's really focused on that. That's cross-cutting research. He's working with folks over in pulmonary health in the School of Medicine. He's also working with an addiction expert here in our school in health behaviors. So again, just to emphasize how collaborative our work is. He's actually got survey work going on right now, trying to get a feel for how prevalent vaping is. I think he's collected data on around 500 research participants. And it does show that somewhere around 20–25% of the individual surveyed admit to using these electronic cigarettes. This is some of my work focusing on maternal and child health. I'll go through this pretty quick. This work is focused on areas in the South and in the Southeast here in the US. We also have a research program funded by the National Institutes of Health and Fogarty International Center at the NIH, looking at maternal child health in the South American country of Suriname. I do a lot of community-based research work, working with communities on issues like food safety and probabilistic health risk assessments, using that kind of information we can get from communities. We did a lot of work after the Deepwater Horizon spill on seafood safety, for example. A lot of work was done here in this department at that time as well. A lot of exposure assessment in community-based research. And in particular, I'm interested in the environmental origins and contributions of environmental risk factors to cancers, adult mental and neurological health, working with some researchers here who are actually doing more basic science, using cell culture and things like that to examine the mechanisms that some of these environmental factors like heavy metals and some environmental solvents may have in terms of leading to things like dementia and Parkinson's disease. Folks over in neurology, so again, very cross-cutting research. And then one of the other areas that I'm focusing on is obesity and how it may increase sensitivity to environmental chemicals. And finally, we have a program or a project, that is pending right now. In other words, we've submitted it for funding that focused on climate change and health, where we are actually looking at chronic kidney disease in agricultural workers in the Caribbean, which we want to expand to the southern US, and how heat exposures and dehydration can contribute to kidney disease and renal disease in our agricultural workers. And Chris Zerol, who is our last faculty member, she's an associate professor here in the department. She and I overlap somewhat, though her focus is more on air pollution. I tend to focus a little less on outdoor air pollution, a little more on indoor air pollution. But she's particularly concerned about children's neurodevelopmental health, neurobehavioral health that result from exposure to heavy metals and other particulates, things like coal fly ash in communities that are located close to places where they are storing or dumping coal fly ash. She also does a lot of exposure assessment, does a lot of collaborative work, as we all do, working with teams. We are definitely team science oriented folks, but she also works a lot in community-based settings. She and I both are particularly interested in collecting environmental samples to look at sources of these types of exposures, and then taking biological samples from research participants like blood, hair, urine, saliva, toenails, deciduous teeth, to look at the actual individual exposures to get a better feel for what is actually getting into the human body in these studies. Chris, as many of us do, uses a lot of different methods in her research. It's not uncommon for us to use focus groups or interviews or survey-based research in all of our work. Exposure assessment is a fundamental concept of environmental health and environmental health sciences, as is toxicology and epidemiology. So these are major areas that we continue to try to improve on, and we're always looking for support to do that. Okay, I think I'm at my end. So before I open it up for questions, I wanted to tell you a few more things that we're working on related to climate change and health. And this really does dovetail with the title of the talk, Ashes to Floods. As you all know, over the last decade, you're just inundated with information all the time from various news media outlets about all kinds of climate change related issues. These days, along with COVID-19 and now with the COP26 conference going on, it's ever more prevalent. But wherever you are in the climate change and health space, I think there's widespread agreement that climate change is occurring. To what degree, I think, is always going to be something to discuss. But how that changing climate can impact our health. So one of the things we've started here in the school, and I'm the lead on this with our Dean Paul Irwin, is an initiative in climate change and health built around hiring a cluster of faculty. We're looking at probably 5 to 6 faculty to bring into the school who really are thinking about this kind of work from an interdisciplinary perspective. So the goal is not to hire 6 different faculty who are either developing research expertise as junior faculty or already have considerable expertise as perhaps mid-career faculty in climate change and health, not to have them be centrally located in environmental health sciences. I obviously am looking for at least one faculty who has expertise in environmental health science, but is also conducting research in the climate change space. We really think that this is an optimal time for UAB, for the School of Public Health, and for the departments in our School of Public Health to really take a lead in building this program. Whether or not it ultimately can become something that the Board of Trustees would approve as a center is something we'll pursue in the future. But right now, we really think because UAB has always taken a really leadership position over its relatively short history with respect to a lot of medical problems, a lot of social problems that impact Alabama, but are not necessarily unique to Alabama. We think this is an optimal time for UAB and our school to pursue this endeavor in climate change and health. So we've got an active search going to look for somebody who could be the leader of this group of faculty and help mentor them. Should we bring on junior folks? And then really integrate them into the larger UAB community. We're working with folks already in terms of identifying suitable candidates to bring in an interview across the campus, folks over in arts and sciences and biology. We are even pursuing individuals who are working in the space of climate change and economics, especially as it relates to policies. So again, very broad, very cross-cutting, so we can be perhaps a leader in the southeastern United States in this area. Right now, the other large centers and very well-known centers that are really impacting research, education, and practice and outreach are in the Northeast, in the Northwest, and in the West. There are some small developing programs in some of our neighbor institutions, but we think we're really coming at this from a much larger vantage, trying to hire a group of faculty that will practice in this space. And so I'm very excited to be a part of this. I'm very excited to share that with our alumni. And, you know, I'm new to UAB. I've been here a year. I'm new to Alabama. I've lived here for 4 months now. Spent the last 12 years in Southeast Louisiana at Tulane University. So very well aware of environmental and issues related to climate change because of my experience there and on the Texas Gulf Coast. But we also have some issues here that need to be tackled. And hopefully these faculty, the goal is to have the faculty work on local issues all the way out to international problems. And especially as we can learn more about international issues and bring that knowledge back here and address local problems here in the Birmingham area and across Alabama. And with that, I think I will stop and we can open it up for questions.
Thank you so much for the information that you provided, Dr. Wickliffe. So I'll just start off with, how do people contact you if they want to get involved, if they want more information from you all?
Email is a very good way to contact me. I've got an office phone too, but it seems like people use the telephone much less these days. So I'd be more than willing to share my email. I'm very responsive. It's not one of those things you'll send me an email and won't hear from me for weeks. I'll respond quickly.
And what is that email address? And I'll drop it in the chat.
Can I type it in there?
Oh, you sure can, yeah.
Let's see here. Yeah, in green, so it's kind of hard to see.
Not a problem at all. So there it is. So it's jwickliffe at uab.edu for anybody that wants to reach out to Dr. Wickliffe. So the faculty that come on for climate change and health need to convince the higher leadership of UAB to become carbon neutral by 2030. This is a comment that we have. So it's in line with the Paris Agreement. This person imagines that it would inspire a new wave of students when they say UAB meeting their moral obligation around carbon pollution. What are the odds of something like that happening at an institution like ours?
Good question. And it's not something that we haven't talked about, at least here amongst ourselves. Certainly with Julie Price and her knowledge of sustainability. We also work with the Office of Sustainability at UAB. As you know, we have a solar house here, which is completely run off the grid. You know, I don't have a good feel for what the odds are. I know we have some real challenges here in Alabama with how we provide power and how we can start to repurpose the provision of power to take advantage of renewables. That's going to continue to be a work in progress. I think to the extent alumni can support us and get however they want, get involved in those conversations, that would be fantastic. And I can do everything possible on my end to kind of keep that conversation going. I know that President Watts and Provost Benoit are very supportive of this effort. Dean Irwin has gone to them more than once just to make sure that if we pursue this, that this is not out of line with anything at the university level or any other level. And we've been reassured several times that this is an area that the university wants to go and build capacity in and become a leader in. And so I think if the academic pace with which things occur too, I'll say, always seems slow to me. And that's just me. I'm not blaming that on anyone else. I tend to see things, you know, you identify a solution and make a decision, and then I want to move on it. So I'm hopeful that over the course of this, probably next 6 to 8 months, we will have brought in by that time maybe 2 or 3 of these faculty already. It may be also we're also looking at the potential to hire a cluster of people all at one time that might come from a particular institution that has a strong program in this area. We are actively searching. In other words, we are not passively searching. So we are messaging out as individuals. We have invested resources in a search firm to help us get this message directly out and get the ads directly out, because we anticipate the individuals that we'd like to bring to UAB are not sitting there looking at job boards right now. They're individuals who are, for what, you know, however you want to phrase it, are comfortable where they are. They're very active in what they're doing, preferably folks that already have active funding in the area that would be relevant to what we're looking for. We've even reached out to some of the climate folks at our sister institution in Huntsville. You may not know, but the state climatologist is located at UAH. So we're looking forward to having a conversation with him. We've reached out to folks in Georgia. So again, we think we have a real opportunity to be leaders here in the southeastern U.S. in this area. And I think if we can move that along in a timely fashion and start to make inroads in this area and open and continue to maintain dialogues with those outside UAB that have, I would say, a vested interest at whatever level in climate change and health, with a focus on reducing our use of fossil fuels, especially for producing energy, then I think it's entirely possible. We're going to have to run a long ways to make it by 2030, but I think we have to set those kind of goals and then do whatever we can to try to reach them.
So we see a lot of electric cars out there on the road today. You know, you got the Teslas, you got the Kia's making one, Chevrolet, Ford, everybody's making electric cars. Do you ever expect the majority of vehicles to be electric? And if so, how soon?
To the first question, yes, I do. I think most of the car companies now are starting to, you know, they've already started moving this direction. And however you are, you know, whatever your views are politically, the current administration is wanting to incentivize car companies to speed that up and move that along. One of the big issues, as you well know, is the charging grid and finding chargers. There are a few here on campus. There's a few around Birmingham, but I think that still remains a challenge. How soon? I think it depends on, again, how fast we decide to move this process along. How quickly are we willing to see this as our future? How quickly are we also willing to see how to electrify the charging grid in a way that's not using fossil fuels? A lot of the charging stations are plugged into the fossil fuel power generating enterprise. So that to me is reduces emissions for sure, but it's still using a lot of energy. So I would hope that we could, you know, again, knowing those targets are 2030, 2035, I would hope in the next 5 years, all of us would start to see a difference in the kind of automobiles we see around us, and perhaps even the delivery vehicles. I know a lot of the big delivery companies are moving towards electric. I saw that Hertz just the other day just bought a bunch of Teslas to try to make inroads into the electric car rental enterprise. So I think those are the kind of things that is different organizations and companies and cities around wherever we are, maybe Birmingham again can take the lead on this. Once they start to move in that direction and then others see that it is doable, I think it'll move a lot faster. I think the hard part are those first steps and trying to convince people that this can work.
Good deal. Well, I know we are right at 1 o'clock, so I want to be respectful of your time, everybody in attendance. Thank you so much for spending the last hour with us, Dr. Wickliffe. It's been great information, great insight into the School of Public Health and your department.
Well, thanks, Greg and Kimberly, for inviting me. And I appreciate all of the alumni who attended today. And thank you so much for your support. And don't hesitate to reach out and contact me about any of this or anything else that we're doing in the School of Public Health or our department. And I would love to come back sometime and give you an update on where things are.
All right. Thank you again. And just a heads up to everybody in our audience, a recording of today's webinar will be made available online tomorrow. Now, with more information about the UAB Office of Plan Giving and how they can help you, I'd like to turn things over to Kimberly Kopic once again. Kimberly.
Great. Thank you, Greg. A plan gift can help you make a powerful and lasting difference to the UAB programs that mean the most to you. Plan gifts offer creative, flexible strategies for your estate and charitable planning. These techniques make use of legal and tax strategies to best suit your unique situation and help you to accomplish your personal and philanthropic goals. Some types of plan gifts allow you to maintain control and flexibility over your assets while supporting UAB in the future. Others allow you to obtain an annual income and an immediate tax deduction. Still others allow you to reduce or eliminate capital gains tax. The UAB Office of Plan Giving is here to help you accomplish your philanthropic goals through a legacy gift. Reach out to me today to learn more about these types of gifts and to find out how they may be a good fit for you or for a loved one. Thank you. I look forward to talking to you.
Thank you so much, Kimberly. Meanwhile, on Sunday, join us for the 13th annual Uncork Education. This year, Uncork Education will feature students from the UAB Department of Music. Join us for this 13th annual Uncork Education, and we have a couple of different levels still to you. The to-go dinners from Perry's, those are out. We're past that, but we are looking forward to selling a few more access passes to the music that we will have, and that will feature concert and gospel choirs, wind symphonies, symphony music, jazz ensembles, things like that. Find out more at alumni.uab.edu/uncork. Don't miss out on what other webinars we have coming up on Tuesday, November 16th. Join us for a special bonus webinar in our Science of series. That evening, we'll explore the science of Thanksgiving with Dr. Lizzie Davis. We know that turkey, stuffing, pumpkin pie, they're all staples of Thanksgiving. But do you know the science behind things like tryptophan and how brining impacts the cooking process and moisture of your bird? Then we'll welcome Robert Smith to our webinars on Thursday, December 9th for an important conversation with grief and the holidays, tips and strategies on how to cope. And before the new year, learn how to wow your family and friends with your cocktail making skills as part of Holiday Mixology 101 with mixologist Ryan Abrams on Thursday, December 16th. If you're looking for a podcast to tune into during your day or to and from work, check out UAB Green and Told. Listen back to episode 54, Concussion Conversation with Dr. Heath Hale and Dr. Kathy Weiss to learn more about concussions. And you can find other topics as well. You can find us on Spotify and Apple Podcast app or visit alumni.uab.edu/green and told. And stay on top of everything alumni on social media. Just search UAB Alumni on Facebook, Instagram, and Twitter. On LinkedIn, search UAB Alumni Career Community. Get a hold of us. Simply email us at alumni@uab.edu. Once again, thank you so much for joining us for today's discussion with Dr. Jeffrey Wickliffe. Have a great afternoon, and as always, go Blazers.